Did you know that 1 in 3 people over 60 already show signs of declining kidney function, but most of them have no idea until it's too late? If you often wake up at night to urinate, if your ankles swell, you feel tired without reason, or your blood pressure swings up and down, please don't skip this video. This isn't just another health tip, this is a warning sign. And maybe your one chance to save yourself or someone you love from ending up on lifelong dialysis. Important. The information in this video is not a substitute for medical diagnosis. If you have chronic kidney disease, diabetes, or high blood pressure, talk to your doctor before making any major dietary changes. What I'm about to share comes from over 30 years of experience as a doctor, working with thousands of older patients who turned their kidney health around by changing just a few small, but powerful, things. I remember it like it was yesterday. One early morning in March a few years ago, a soft-spoken woman walked into my clinic. Her name was Mrs. Eleanor, age 67, with worry in her eyes. She said, "Doctor, I just had my annual checkup. They said my creatinine levels are going up. If I don't change something soon, I may have to start dialysis. I'm scared." As we talked, I realized she wasn't doing anything wrong. But the truth is, even a normal diet can quietly damage the kidneys when we get older. The good news, just 6 weeks after she followed a simple plan I gave her, centered around 5 inexpensive, everyday fruits, her creatinine levels dropped, her blood pressure stabilized, and the swelling in her legs disappeared. And then she told me something I'll never forget. "Doctor, if I had known about these fruits earlier, maybe I wouldn't have spent so many nights wide awake, worried and afraid." So what were those 5 fruits? How could something so simple cleanse the kidneys, boost filtration, prevent kidney stones, and even help delay, or avoid, dialysis? The answer isn't luck, it's science, and I'm going to walk you through the exact biological mechanisms behind each fruit, so you'll understand why your body begins to heal when you eat right. But before we jump in, let me warn you about 2 mistakes that over 80% of older adults make. They drink plenty of water, but don't eat the fruits that naturally support kidney cleansing and reduce inflammation. They buy store-bought kidney-friendly juices, but those are often loaded with sugar, which worsens inflammation and increases the pressure on the kidneys. Backhand index pointing right: your kidneys don't need expensive superfoods. They need foods that are easy to absorb, anti-inflammatory, and gentle on your aging urinary system. If you're in your 50s, 60s, or beyond, please remember this: we can't turn back time, but we can stop our kidneys from aging faster than they should, and sometimes, all it takes is the right fruit at the right time to make a life-saving difference. If you or someone in your family has struggled with kidney issues, leave a comment and share your story below. Don't be shy, your experience might just give hope to someone who's feeling lost right now. This isn't just a health channel, this is a community of people helping each other live longer, better, and stronger. Round pushpin coming up next. I'll reveal the first fruit on the list: small, red, slightly tart, but powerful enough to fight infections, prevent stones, and gently cleanse your urinary system, naturally. Over 200 scientific studies back this up, so keep watching, because after today, you'll never look at this fruit the same way again. Cranberries, the little red fruit that silently shields your kidneys. There's a tiny, tart fruit, often treated as a holiday side dish during Thanksgiving. But if you're over 60, or have a history of urinary tract infections, frequent nighttime urination, or kidney stones, this fruit might be quietly saving your kidneys every day without you even knowing it. No prescriptions, no machines, just simple daily choices: a glass of water, a slice of lemon, and the belief that your body deserves to heal. Sun behind small cloud. And the most beautiful part is this: you don't need anyone's permission to start healing. Sometimes, it's the quietest foods in our kitchen that are fighting for us every minute of the day. I still remember a dear patient of mine, Mrs. Eleanor, 67, from Florida. She came to see me after suffering from recurrent urinary tract infections for nearly 5 years. antibiotics would work for a few weeks, then the infection would come roaring back, leaving her exhausted, afraid to use the restroom, and struggling with cloudy urine and sleepless nights. After a full workup, I noticed her left kidney was showing early signs of inflammation. Her creatinine was slowly creeping up. She looked at me, hands trembling, and asked, "Doctor, am I going to lose my kidney?" I took her hand gently and said, "Not yet, Eleanor. But now is the time to help your kidneys, starting with the smallest steps. Like switching your morning water to a glass of unsweetened cranberry juice." She nodded and gave it a try, and just 8 weeks later, no more infections, her inflammation markers dropped, and she returned to my clinic with a smile I'll never forget. "Doctor, I finally sleep through the night again." If you, or someone you love over 60, has ever dealt with urinary infections, persistent nighttime urination, or kidney stones, please share your story in the comments below, because your experience might help someone else avoid months of antibiotics, or even dialysis down the road. Cranberries are rich in a special compound called proanthocyanidins, PACs. This compound blocks E. coli, the main culprit behind UTIs, from sticking to the bladder wall or urinary tract lining. When bacteria can't stick, they get flushed out naturally through urine. Cranberries are also rich in canic acid, which slightly alkalizes the urine, helping to prevent calcium oxalate kidney stones, ease the daily workload of your kidneys, and thanks to their high levels of vitamin C and flavonoids, cranberries neutralize free radicals, protecting delicate kidney tissues from premature damage. If you don't step in early, especially when UTIs keep returning, you may be walking yourself into infections that spread to your kidneys, formation of kidney stones, and eventually, chronic kidney failure, and by that stage, medications, dialysis, or even transplants won't be choices anymore, they'll be your only path. A 2016 study published in the American Journal of Clinical Nutrition found, women who drank 500 milliliters of unsweetened cranberry juice daily reduced their risk of recurrent UTIs by 39% compared to the control group. Another 2011 study from the Journal of Urology concluded, cranberries not only reduce urinary infections but also improve urinary pH and reduce stone-forming risk in susceptible patients. If you're taking blood thinners like warfarin, have a history of severe oxalate kidney stones, or are allergic to berries, please speak to your doctor before making cranberries a daily habit. Many people think drinking cranberry juice is always good for the kidneys, but over 90% of store-bought cranberry drinks are loaded with sugar or artificial sweeteners, both of which inflame the kidneys and increase toxic load. As a physician, here's what I recommend: go for fresh or frozen cranberries whenever possible. If you drink juice, choose one labeled 100% juice, no added sugar. Add cranberries to your breakfast, mix into oatmeal, toss into salads, or blend into smoothies. Cranberry kidney-loving smoothie: half a cup frozen cranberries, 1/2 banana, 1 cup unsweetened almond milk, 1 tablespoon chia seeds, 1/2 teaspoon honey, optional, blend until smooth. Drink it 30 minutes before breakfast. But cranberry is just the beginning. In the next part, I'll reveal a cool, sweet summer fruit, something you probably already enjoy, yet very few people realize it's one of nature's most powerful diuretics, and chances are, you might be eating it the wrong way. Watermelon, the secret behind every sweet drop, a refreshing fruit that can rescue your kidneys, if you use it right. In the summer, watermelon is a favorite among older adults, but did you know, if used the right way, watermelon can help flush out your kidneys daily, increase urine output, lower blood pressure, and even prevent dialysis down the line. But if used the wrong way, it becomes a silent double-edged sword, quietly harming your kidneys without you knowing. Let me tell you about Mr. Harold, 71 years old, from Texas. He came in for a routine checkup. Seemed pretty healthy at first glance. But then he told me, "I wake up 3 to 4 times a night to pee. My legs swell a little during the day. And lately, I've been feeling really tired. And I don't know why. We ran some labs. His creatinine was creeping up. His GFR had dropped below 60, an early sign of kidney dysfunction. I asked him gently, "Are you drinking enough water?" He chuckled, "I don't like plain water much, but I eat a lot of watermelon every day." That's when I smiled and said, "That might just be your saving grace, if we use it the right way." So, I walked him through how to combine watermelon with simple kidney supportive habits, and just 5 weeks later, Harold returned, heavy checkmark easier urination, heavy checkmark no more swelling in the legs, heavy checkmark slept through the night, undisturbed, heavy checkmark kidney function clearly improving. With a gentle smile, he said, "Doctor, I never thought a watermelon could make me feel this good." Watermelon is over 90% water, helping the body produce more urine and flush out toxins before they accumulate in the kidneys. It also contains citrulline, an amino acid that relaxes blood vessels, improves circulation to the kidneys, and helps lower blood pressure, one of the top contributors to kidney failure, and thanks to its high lycopene content, watermelon acts as a strong antioxidant, protecting kidney tissues from free radical damage. In short, boosts natural detoxification, reduces inflammation, supports stable blood pressure, so your kidneys can breathe easier and work more efficiently each day. A 2020 study in Food and Nutrition Research confirmed, watermelon increases urine output and reduces urinary concentration, which lowers the risk of kidney stones and chronic kidney inflammation. Another study in the Journal of Hypertension, 2014, revealed, citrulline in watermelon may help dilate blood vessels, improving circulation to organs such as the kidneys and heart, especially in older adults. But if you don't take it seriously, you don't hydrate properly, you ignore signs like nighttime urination or leg swelling. You don't support your kidneys with the right foods, then the kidney's ability to filter your blood will continue to decline, quietly, day by day, and the result? Chronic fatigue, uncontrolled blood pressure, and eventually lifelong dialysis. You'll lose your independence, rely on machines, and spend your final years in and out of hospitals. No entry. Many people eat watermelon as dessert, right after salty meals, which causes the body to retain water and puts extra strain on the kidneys. No entry. Some eat it ice cold straight from the freezer, which temporarily constricts blood vessels and slows digestion, again impacting kidney function. Here's how to get the most out of watermelon. Eat it in the morning or between meals, avoid eating it after dinner, don't add sugar, salt, or ice. You can also blend it into a refreshing smoothie with mint, or make a watermelon salad for a hydrating, kidney-friendly treat. Kidney Cleanse Watermelon Salad, 1 cup cubed watermelon, half a cup sliced cucumber, a few crumbles of feta cheese, optional, 1 tablespoon olive oil, a handful of fresh mint, toss together and enjoy mid-morning or in the afternoon. Cool, refreshing, and great for your kidneys. Are you eating watermelon every day? Have you noticed improvements in nighttime urination or leg swelling? Backhand index pointing right. Share your experience below, because your honest story might help someone else avoid dialysis in the future. And if you're worried about kidney stones, especially when your urine looks cloudy, or you feel a dull ache in your lower back, don't go anywhere. Because next, I'll reveal a bright yellow fruit that's hiding in almost every kitchen, and yet very few people know it can dissolve kidney stones naturally, without medication. This is the one fruit I recommend every patient drink each morning, even before the first signs of kidney trouble appear. Lemons, the cheap little yellow fruit that can stop kidney stones and cleanse your urinary tract every single morning. There's one fruit almost every kitchen has. It's cheap, easy to find, and often overlooked, but this little fruit is one of the most powerful natural shields against kidney stones, urinary toxins, and elimination troubles. That fruit is the lemon. Small, but mighty. George, 70 years old, is a Jewish gentleman from Arizona. He'd never had kidney issues, until last year. One night, he was struck by sharp pain near his lower back. peed blood, and had to be rushed to the ER. Doctors found a 6 mm kidney stone. At the same time, his wife Linda, 68, was also diagnosed with a urinary tract infection, caused by chronic dehydration. I met them during a follow-up visit. Both were shaken. "Doctor, what if this comes back again?" It was the worst pain of our lives. I gave them a simple prescription, not a drug, but a habit. Backhand index pointing right, squeeze half a lemon into warm water every morning on an empty stomach. Backhand index pointing right, stick to it for at least 3 months. The results: George had no new kidney stones a full year later. Linda had 0 UTIs after that. They both slept better, felt lighter, and most importantly, no longer feared another emergency room visit. Lemons are rich in citric acid, especially citrate, a compound that raises urine pH, making it less acidic. Inhibits calcium from crystallizing, preventing oxalate and uric acid stones. Binds to excess calcium to form a soluble compound easily flushed out in urine. Plus, vitamin C in lemon strengthens the immune defense of the bladder and kidneys. Flavonoids in lemon peel reduce inflammation in kidney tissue. In short, lemon water each morning equals flushing kidneys, dissolving stones, easing elimination. A 2014 study in the Journal of Urology found just 2 glasses of lemon water a day reduced kidney stone recurrence by 39% in past patients. Another study in Kidney International Reports, 2020, confirmed. Lemon juice increases urinary citrate levels and decreases calcium crystallization in patients prone to stones. Common mistakes: no entry. Many people add too much sugar or honey, raises blood sugar, counteracts the benefits. Use bottled lemon juice, contains preservatives, loses natural enzymes. No entry. Some drink lemon water too strong on an empty stomach, leading to stomach pain. As a doctor, here's what I recommend: squeeze half a fresh lemon into 1 cup, 250 milliliters, of warm water, no sugar, no honey. Drink it 20 to 30 minutes before breakfast. If you have acid reflux, dilute more, or drink after a light snack. Lemon morning cleanser: 1 cup warm water, juice of 1/2 lemon, 1 teaspoon apple cider vinegar, if no stomach sensitivity. 1 thin slice of fresh ginger. Drink for 2 weeks each morning to support your kidneys, liver, and digestion. If you ignore morning lemon water, don't stay hydrated, and don't actively prevent stones, you may soon face sudden stabbing pain, bloody urine, repeated UTIs, irreversible kidney damage, and when that happens, every ER visit, every sleepless night, will feel like a painful reminder that you could have prevented it, with the cheapest fruit in your kitchen. Do you drink lemon water in the morning? Have you noticed any changes? Backhand index pointing right. Share your experience below, because your story might be the warning, or hope, that helps someone else avoid dialysis. Here in the Better Health After 60 community, we keep one another alive, one small habit at a time. So far, we've talked about cleansing, flushing, and anti-inflammatory support for your kidneys, but there's another hidden danger: oxidative stress and chronic inflammation, especially in people with diabetes. And the next fruit, small, deep purple, is a powerhouse of antioxidants. In fact, it's proven to protect the glomerular function of aging kidneys. You've probably seen it everywhere in the US, but you've never truly understood its power, until now. Blueberries, the purple warrior that protects your kidneys from chronic inflammation and glomerular decline. There's a kind of kidney damage that creeps in silently. It doesn't cause pain. It doesn't show clear symptoms, but day by day, it erodes kidney tissue, weakens your blood filtering ability, and brings you closer to chronic kidney disease, especially if you have diabetes. Thankfully, nature also gave us a small but mighty anti-inflammatory shield: blueberries. Mrs. Doris, 73, lives in Oregon. She's a retired math teacher, lives alone, and leads a disciplined life. Vegetarian. No alcohol, no smoking, but age and family history caught up. At 68, she was diagnosed with type 2 diabetes. By 73, Her GFR had dropped to 52, and her creatinine started creeping up. She asked me, "Doctor, I do everything right. Why can't I protect my kidneys?" I looked through her food journal and asked, "Do you eat blueberries?" She replied, "I thought they were too expensive and too small to do any good." I smiled and said, "Then you're underestimating one of nature's strongest anti-inflammatory superfoods." I gave her a new plan: just half a cup of blueberries each morning for 90 days. 3 months later, her eyes welled up with gratitude. Her HbA1c had dropped, GFR had slightly improved, nighttime urination had reduced, the dull back pain she always felt gone. Blueberries are rich in anthocyanins, powerful natural antioxidants that neutralize free radicals damaging kidney tissue, reduce chronic inflammation in the glomeruli, the most vulnerable part of diabetic and hypertensive kidneys, strengthen tiny blood vessels, improving kidney microcirculation. Also, the fiber and polyphenol in blueberries help stabilize blood sugar after meals, protecting your kidneys' fragile capillaries from glucose spikes. A 2019 study in clinical nutrition found that seniors who ate 50-75 g of blueberries daily for 12 weeks had lower inflammation markers, CRP, IL-6. Improved kidney function. Another paper in the Journal of Medicinal Food, 2018, reported anthocyanins from blueberries have renal protective effects in diabetic nephropathy by suppressing inflammatory pathways. Common mistakes: no entry. Many people buy sugar-packed canned blueberries or dried ones stripped of flavonoids, loaded with added sugar, only eat them during fresh harvest season, unaware that frozen blueberries retain their full nutritional value and can be enjoyed year-round. Stethoscope. As a doctor, I recommend half a cup, about 75 g, of blueberries every morning. Fresh or frozen are both excellent. Mix with oats, yogurt, smoothies, or add to salads. Warning: avoid canned blueberries. Any product with added sugar or syrup. Blueberry-flavored foods with no real fruit. Kidney-loving blueberry smoothie: half a cup frozen blueberries, 1/2 ripe avocado, 1 cup unsweetened almond milk, 1 tablespoon ground flaxseed. Blend and drink mid-morning. It calms inflammation and boosts kidney blood flow. We've just uncovered the quiet power of blueberries in protecting your kidneys. But what if I told you there's a fruit that doesn't just cleanse, but can also repair damaged blood vessels inside your kidneys? And not just that, this fruit helps your heart beat smoother, thanks to a rare antioxidant also found in red wine. I'm talking about red grapes, and the miraculous story of Mr. Frank might just make you believe that sometimes, eating right can heal more than medicine ever could. Chronic inflammation in your kidneys might not hurt now, but over time, it's the silent killer behind glomerular scarring, GFR dropping below 30, and, eventually, weekly dialysis. At that point, it's not just fatigue, it's your body crying out for help, one exhausted cell at a time. Are you living with diabetes, high blood pressure, or early-stage kidney issues? Have you tried eating blueberries daily? Backhand index pointing right. Please share your experience below. We're not just viewers, we're a community fighting kidney decline. Red grapes, the fruit that revives kidney blood vessels and stops kidney failure at its root. We've all heard, red grapes are good for the heart. And that's true, but what most people don't know is, red grapes are also powerful allies for the kidneys. They improve blood flow to kidney tissue, reduce microinflammation, and slow down the scarring process of glomeruli in older adults. Mr. Frank, 75, is a retired veteran who served in Europe. He now lives with his wife in Colorado. He had been managing typical age-related issues like high blood pressure and high cholesterol, but during a routine checkup, his doctor said, "Frank, your kidney function is declining faster than expected. Your GFR is now under 55, and your urine shows rising albumin levels." Frank looked at me with worry. "What am I doing wrong, doc?" "I cut salt, quit beer, walk every day." I asked, "Do you eat red grapes?" He replied, "No, I avoid grapes." I thought they were too sweet. I explained gently, red grapes, in moderation, don't just not harm your kidneys, they can actually improve blood circulation to the kidneys and slow down kidney scarring. We redesigned his meal plan, fresh red grapes 4 times a week, low-sodium diet with proper hydration. 3 months later, Frank returned with results that surprised us both. GFR had stabilized, protein in urine dropped, blood pressure improved. And he said something that touched me deeply, document. I feel like I just gained 5 more years of life. Red grapes contain resveratrol, a potent polyphenol that helps dilate small blood vessels, increases blood flow to glomeruli, reduce endothelial inflammation, protects vessels from chronic damage, inhibit oxidative injury to kidney tissue caused by high glucose or blood pressure. Also, anthocyanins in grape skin fight fibrosis in kidney tissue and promote the regeneration of tiny renal capillaries. In short, red grapes are both the circulation doctor and the microscopic protector of your kidneys, especially vital for seniors with chronic conditions. A 2021 study in Nutrients found that resveratrol improved renal hemodynamics and reduced microvascular damage in diabetic patients at risk of kidney failure. Another study from the Journal of Renal Nutrition, 2017, confirmed a diet rich in red grape flavonoids slowed kidney disease progression and improved creatinine clearance in older adults. Common mistakes: no entry. Many people eat too many grapes causing blood sugar spikes, drink red wine for the kidneys, but alcohol can harm kidneys if consumed regularly or in excess. Peel the grapes not knowing that resveratrol is concentrated in the skin. I recommend 2 to 4 times per week, a small handful, 15-20 grapes, eat with skin on, rinse thoroughly, best consumed mid-morning or afternoon, not directly after meals. If diabetic, speak with your doctor to adjust for carbohydrate intake. Kidney circulation booster salad, 1 handful of red grapes, halved, 1/2 avocado, a small handful of baby spinach, 1 tablespoon extra virgin olive oil, a few slices of toasted almonds, mix and enjoy in the afternoon. This helps relax blood vessels, lower microvascular pressure, and protect the glomeruli. Your kidneys don't just filter, they rely on an intricate network of microvessels. If these blood vessels become hardened, inflamed, or clogged, then blood can't reach the nephrons, waste can't be flushed out, and your kidneys will slowly shut down, piece by piece, without you even feeling it. Don't let the silence of your kidneys fool you into false confidence. Have you ever used red grapes to support kidney health? Do your parents, siblings, or loved ones face the risk of kidney failure? Backhand index pointing right. Share your story below, because your small tip could be someone else's big breakthrough. This community exists because of you, and for you. 5 fruits, from tart to sweet, from cleansing to vessel repairing, are nature's way of guarding your kidneys. But don't wait until dialysis is your only option. Every fruit you eat today protects a piece of your kidneys for tomorrow. Just 5 simple fruits, but if eaten the right way, they can help delay dialysis for 10, maybe even 20 years. That's not just a belief, it's something proven by science and witnessed by thousands. Dear friend, in over 30 years of medical practice, I've met hundreds of patients just like you. They weren't careless, they weren't irresponsible, they were simply too late. They came when their kidneys were already tired, when their urine had changed color, when their legs began to swell, when breathing felt heavier, and when their doctor looked them in the eye and said, "It's time to start dialysis." But if you're still watching right now, you're one of the lucky ones, because now you know the 5 fruits that can. Heavy checkmark flush out toxins each morning. Heavy checkmark soothe chronic kidney inflammation. Heavy checkmark prevent kidney stones. Heavy checkmark improve blood flow to renal tissue. Heavy checkmark can slow down the silent clock inside your hardworking kidneys. But knowledge is nothing unless you take action. So let's begin. Tomorrow morning, a warm glass of lemon water, a handful of blueberries with breakfast, a bowl of watermelon at noon, some red grapes in the afternoon, a spoon of unsweetened cranberries before bed, backhand index pointing right. It's not expensive, backhand index pointing right. It's not complicated, backhand index pointing right. You just have to choose wisely, and stay consistent. If you've ever experienced frequent nighttime urination, swollen legs, weak kidneys, or even dialysis. If your loved one is in the early stages of kidney decline, leave a comment below, megaphone, because your story might be the wake-up call someone else desperately needs. Just remember this one thing: the kidneys never cry out in pain. But their silence comes at a price: your freedom in the final years of life. Love your kidneys, the way they've quietly loved you, filtering your blood, day and night, for decades. And the most miraculous part, you don't need a prescription to begin healing. Just fruits. Simple, humble fruits. They may be the very thing protecting your kidneys, hour by hour, moment by moment. Thank you for staying until the end. If this video touched you, please leave a kind wish for those battling kidney disease in the comments. And if someone in your life is feeling overwhelmed by kidney problems, share this video. Because sometimes, one video, one share, can save a life. Backhand index pointing right. Together, we're not just spreading knowledge, we're building a community of compassion, care, and action for better health. Thumbs up like this video to help YouTube recommend it to others who need it. Bell subscribe to Better Health After 50 for more videos from a doctor who truly cares. Outbox Tray. Share this video with someone you love. You may never know, but you just might save them. See you in the next video, where I'll reveal the hidden foods silently damaging the kidneys every single day, especially the ones older adults often eat without realizing the harm. Don't miss it, because your health is our shared journey.